Introducing our sustainability champions, our dedicated team within the California Society of Anesthesiologists is leading the charge on sustainability. These professionals are committed to transforming healthcare practices and raising awareness about the vital role of anesthesiologists in addressing climate change. Stay tuned as they share their insights and inspire action toward a more sustainable future. Nitrous oxide, often abbreviated as N2O, is a compound widely used as a sedative or anesthetic gas in medical procedures. While its medical applications are well documented, the profound environmental consequences of this seemingly innocuous gas are far less commonly understood. Nitrous oxide, it turns out, plays a significant role in environmental issues, serving as both a potent greenhouse gas and a contributor to ozone depletion. While there are many champions leading the way in nitrous oxide waste, we will hear from three California champions in nitrous oxide reduction are Dr. Leela Hebshi, Dr. Arash Mohammed, and Dr. Nina Schlammer-Kemper. Dr. Leela Hebshi, an anesthesiologist at Kaiser Oakland, is driven by a lifelong commitment to sustainability. Her passion was sparked during her graduate and medical school years, where she conducted environmental research. Reflecting on healthcare waste, she aptly notes, "Once you see it, you cannot really unsee it." Dr. Arash Mohammed, Associate Professor of Clinical Anesthesiology at USC's Keck School of Medicine, serves as the Medical Director of Sustainability. He emphasizes the importance of balancing excellent patient care with environmental responsibility, stating, "Our efforts to provide excellent care for our patients should not come at the cost of the environment, which further deteriorates population and environmental health." Dr. Nina Schlammer-Kemper, Professor and Clinical Director of Obstetric Anesthesia at UC Davis Health, underscores the significance of reducing greenhouse gas emissions. She highlights the collective impact of individual actions, stating, "Reducing greenhouse gas emissions is vital to combat climate change. Our contributions may seem small, but when combined, they can make a significant difference." The global warming potential, or GWP, is a chemical property that describes the ability of a gas to trap heat in the atmosphere. Volatile anesthetics and nitrous oxide are far more potent greenhouse gases than CO2 and methane, as shown in the table. Nitrous oxide, N2O, is not only a potent greenhouse gas, it is the leading cause of ozone depletion worldwide. When used with sevoflurane and isoflurane to carry volatile agents, nitrous oxide increases greenhouse gas emissions compared to higher concentration volatile agents carried in oxygen. A significant amount of purchased nitrous oxide is lost to the environment due to leaks from centralized storage tanks and during its transportation through pipelines to anesthesia machines. These factors contribute to the environmental impact of nitrous oxide in healthcare settings. There is a movement in sustainable anesthesia to address nitrous oxide leakage. Use e-cylinders. Disconnect and retire the central storage of nitrous oxide. Do not build central storage tanks in new buildings. Dr. Leela Hebshi will be sharing her first-hand experience in addressing nitrous oxide leaks. So how do we even detect these leaks in the first place? Much credit goes to clinical scientists like Alafia Shakera, a public health scientist who conducted a groundbreaking study in 2021 called Nix the Nitrous. Our research shed light on the potential to reduce nitrous oxide use and raised an alternative hypothesis that the problem wasn't excessive use, but rather wastage within the system. The scale of nitrous oxide waste is staggering, driven by overspecification and capacity issues in NHS sites. By March 31, 2021, Alafia Shakera reported that healthcare sites across the UK and the Republic of Ireland had reported nitrous oxide waste, totaling 13.7 million litres annually. This meant 95% of the purchased nitrous oxide was vented into the atmosphere. Notable figures like Dr. Brian Chesbro, the Medical Director of Environmental Stewardship at Providence Health in Oregon, and researchers like Dr. Forbes McGann, Associate Dean of Healthcare Sustainability, Medicine, Dentistry, and Health Sciences in Australia have also lectured and published data on nitrous leaks, further validating Dr. Chakra's work. Dr. Hebshi, what challenges or barriers have you encountered while eliminating nitrous oxide leaks? we've faced several challenges while addressing nitrous oxide leaks. First, obtaining quantitative data on nitrous oxide purchasing has been quite challenging. Our purchasing process needs more transparency, making it easier to track. Second, we're in the process of finding a suitable location for storing backup e-cylinders. Lastly, we've encountered regulatory hurdles with Cal OSHPD, CDPH, regarding the retirement of nitrous oxide, which they seem to consider an essential medical gas. Now let's go to Dr. Nina Schloemer-Kemper. What resources have we used to tackle the nitrous oxide leak issue? Well, the University of California Office of the President, or U100OP, Sustainability, set a goal to eliminate all greenhouse gas emissions by 2045, with several of the University of California campuses expected to be most of the way there by 2030. They gave our efforts credibility and prevented them from being dismissed as fringe or tree-hugger ideas. Now, let's talk about the key elements that were vital to our sustainability efforts and eliminating nitrous oxide leaks. First and foremost, the support from our department chair was crucial. We formed a team of various experts, some of whom clinicians typically don't interact with regularly. We were lucky to have a highly motivated and knowledgeable member of environmental health and safety on board. They understood the pipeline systems inside out and collaborated closely with our head of anesthesia techs. We took proactive steps, such as removing the N2O hoses, connecting the machines to the wall, and meticulously measuring each cylinder's usage at different times. This data was instrumental in calculating usage and purchasing information. We demonstrated that most leakage occurred through pipelines. This evidence helped ease resistance and showed that most leaks were not due to the machines themselves.
Dr. Arish Modane will answer the next few questions. How has your progress in this area affected your group practices workflow and efficiency? Since February 2023, we've observed no negative impacts on our workflow or efficiency after removing nitrous oxide. Our workflow has evolved to have the anesthesia support staff close the e-cylinders, assess, and if needed, replaced on a Friday, and on a Monday, the e-cylinders valves are open. So far, all anesthesia staff and technicians are in agreement and can access nitrous oxide when needed. Has eliminating nitrous oxide leaks impacted your practice's quality of anesthesia care? Eliminating nitrous oxide leaks has not had any noticeable impact on the quality of anesthesia care provided at our institution. Have financial benefits been realized due to these sustainability efforts, specifically from reducing nitrous oxide leaks? We, as many institutions, find that separating the cost savings from eliminating nitrous oxide central supply compared to the e-cylinder switch can be complicated to calculate. Other institutions have reported savings of around $10,000 to $12,000 per year at major academic centers. Dr. Schloemer-Kemper at the University of California, Davis reports savings of $12,000 annually. Nitrous is not expensive, but worth a lot in environmental dollars. And finally, were there any unanticipated problems or issues that arose after implementing the measures to decouple nitrous oxide from the central supply? One unanticipated issue we encountered was related to machine check failures. Nitrous oxide was originally part of the automatic anesthesia machine checkout process, leading to these failures. However, we addressed this problem by reaching out to GE, and they made the necessary adjustments to the checkout process.
These are some of the institutions that have already eliminated or are in the process of removing nitrous oxide. Drs. Moat Ahmed at University of Southern California and Drs. Schloemer-Kemper at the University of California Healthcare. Dr. Leela Heb, she the Kaiser Permanente Northern Healthcare System, among other Kaisers, are making these changes. Drs. Praveen Kalra and Rachel Out-Turson at Stanford and Drs. Carol Lynn and Rebecca Clore at the Lucille Packard Children's Hospital are addressing the nitrous waste. And there are many more institutions and champion anesthesiologists in our California society. Dr. Arash Motamed, were there unexpected benefits? Yes, more residents, students, and faculty signed up for sustainability projects. This shows that many people want to do something to address the climate crisis. Dr. Schloemer-Kemper has advice as well. To quote, "Sustainability is a team effort. And if you have machines that support cylinders and happen to have cylinders on all machines already, you are golden, and transitioning should not be too difficult. And Dr. Hebsha has some advice. If you do this project at your hospital, you need an excellent facilities champion who can help you with the literal nuts and bolts in a systematic way to get you to your goal. Thank you for sharing your time with us. For more information, please visit the California Society of Anesthesiology at csahq.org.